Throughout the pandemic, our team at the department, in partnership with health systems and providers around the state, have worked to gather and share information to ensure Iowans have the tools they need to protect themselves and go about their lives. Every day, these systems are exchanging data. And every day, our team of public health professionals are reviewing and making decisions to best protect health. As we know more about COVID, and as the new variant is now dominant, our approach has evolved. We continually reassess the information we're sharing and the way that we're sharing it. Earlier this summer, on July 7th, we scaled back the frequency of reporting on our coronavirus.iowa.gov website. For context, we were one of the last states in this region to do this, and we consulted with our other state partners, the officials in those states, and our federal partners who had also at that time shifted to weekly reporting. The situation, though, has evolved, and we are not where we were a year ago, in a good way, mostly. But we also hear you. We know that as the virus evolves, as we see states struggling with high case counts in the South, and as we hit another milestone in our response, it's time to make another shift. We owe it to you to share and ensure that you have access to clear information. And I want you to hear it from me, that every day, all along, internally, we are looking at critical data points. We're working closely with hospitals, and in fact, we've developed new technology to ensure that they have the data they need to adjust operations. Today, there is a clear interest we're hearing from Iowans to know and understand more, and so we're adjusting our public reporting. We recognize reporters who have told the story about our COVID response from the beginning, along with legislators want more information, but also business owners do, educators do, everyday Iowans do. And so we're reformatting our COVID website to highlight the things we think make the most sense to focus on. This includes making hospitalization data more prominent. This also includes, for the first time, the associated vaccination status for those hospitalized. We're also pushing these key metrics to the landing page so that it's easier to see. And it's easier to see what this looks like over time, as compared to a marker of when we deployed vaccinations to all Iowans. While we still update the site weekly with deeper, more comprehensive data, which we know that other professionals and our data consumers analyze, these updated dashboards will be pushed out on Mondays, Wednesdays, and Fridays. It is our goal to highlight the critical information Iowans want more frequently, but this approach and frequency also allows time for our data team to ensure the accuracy of that deeper level information. We know there's an intense interest and need, and we've packaged what we hope resonates and shows Iowans what today looks like in our system. Of course, we stand ready to adjust once again should we need to. Our response does continue to evolve. And thank you for the time today, and please use the answer that the governor just mentioned. We have it right in front of us. For your neighbor who's a nurse, for your child, or for your grandmother, please get vaccinated.